In Health Watch, a brand new study reveals the major causes of death in the U.S. broken down by county. In Harris and all surrounding counties, the leading cause of death is cardiovascular disease. Here to talk more about this is Dr. William Ross Brown, a cardiovascular disease specialist affiliated with Memorial Hermann Memorial City. Good morning to you. This sounds like a huge wake-up call because a lot of times cardiovascular disease is something that we can prevent, isn't it?
Correct. Yeah, I think it is a wake-up call. We've known for some time now that cardiovascular disease is the #1 killer of Americans.
When we hear cardiovascular disease, what do you mean by that? What has taken the lives of so many people locally?
Good question. When we talk about heart disease in general, we're talking about the plaque buildup in arteries. Plaque is composed of fat and cholesterol particles, and if it progresses, can impede the blood flow to the heart muscle.
Is somebody more at risk of this than other people besides just lifestyle?
Certainly, yeah. There are certain medical conditions that put people at risk, certain patient populations, demographics that put people at higher risk. We talk a lot about risk factors, which I can go into. Basically, when we think about risk factors, we think about two classes of risk factors: those that we can modify and those that we're stuck with and that we can't. So the risk factors that we cannot control obviously are our age, our gender, and our family history. We know that having a family history puts us at higher risk of heart disease.
Well, we saw a lot of those other ones that we can. It seems like when you talk about eating healthy and exercising, quitting smoking, it seems like a lot of the times those fall on deaf ears. But it's a big part of it.
Right, and you can do things about your blood sugar, your hypertension, your blood pressure. Stopping smoking is very important. Getting your weight under control, and things like that are very important.
This time of year, people are going to start talking a lot about those resolutions, at least in a few days, right? What would you say to somebody to actually help them go over that hump, to make those lifestyle changes last longer than a few weeks?
Well, I think it's important to make a gradual change and to do things that you're able to do, and not just jump right into it. Make changes that you can sustain and that can last for a period of time, so you can make it a lifestyle modification.
We know it's so important to keep an eye on our hearts. When do you know it's time to see a specialist versus just your doctor?
I think the earlier the better. The American Heart Association recommends that we start screening for blood pressure, weight, and cholesterol numbers as early as age 20, really. And certainly if you're having any kind of symptoms like chest discomfort, shortness of breath, then it's best to get checked out.
All you have to do, speaking of heart, and while you're here, I wanted to ask you about this, all you have to do is get on social media for a moment and see what fans are saying about Debbie Fisher's death. Everyone's saying, all of her fans are saying she died of a broken heart. And we do hear of broken heart syndrome. Doctors are saying it looks like a stroke. What is broken heart syndrome, and can the stress of losing a loved one or a major stress actually cause death?
Absolutely. High levels of stress contribute to heart disease, and stress, in fact, can be, a major life event like this can be an inducer of a heart attack, and it has been shown to be a significant cause of cardiovascular mortality.
All right, I think it's important for people to realize that can have a big effect on you.
Absolutely.
Thanks for your time for coming from Memorial Hermann today. Great
You're
to
welcome.
talk to you.
Thanks for having me.
All right, happy almost New Year to you.
You too.